Right now.
Let's go.
You can hold it. That's good. I was just going to let you guys know, I came a couple weeks ago for you guys who weren't here and talked about the internship program. I just wanted to let you know I have brought the applications for the internship program with basically an overview of everything that's going to be available in the internship program. So if any of you guys want an application or would like to have a read-through of what that's going to entail, Logan, this fine-looking gentleman with the sweater and the glasses right here.
I handed them to Jason. They passed them out.
Handed them to Jason, and it's already passed them out. So I was outside on the phone.
We're super prepared today.
Fixing a car. So if you guys have any questions about this, I only printed 20 or 21 copies. We were limited on time and paper this morning, so if anybody does not get one, just speak with Jason. He'll get a photocopy for you. But if anybody has any questions, I'll be here during the day, and you can touch base with me until Dr. Schwartz needs to leave, because he is my ride. All right? So, thanks.
Thanks, Rob. All right, Dr. Schwartz. We can find you one.
All right, I'm going to ask all you guys to move up front. I'm sorry, I know it's awkward and everybody's settled in, but please just come up here. No, like for real.
Like sitting
Just
here.
move forward. We'll get there eventually. All right.
Let's go, Nick.
All right, so you guys have been talking about cranial nerves at some point, yeah?
Yeah.
Okay, so as far as brainstem goes, in the midbrain, cool. What cranial nerves come out of the midbrain? 3 and 4, okay? And what do they control?
Oculus.
Which one does what? What does 3 do?
Pupillary constriction, most eye movements.
Okay, which eye movements does 3 not control?
Does not do.
Lateral rectus, superior oblique.
Okay, what does superior oblique do?
Down and out.
Yeah, down and in.
Down and in.
Down and in.
Okay,
And torsion.
so, pons. What comes out of the pons? Shut up. What comes out of the pons?
Hypoid.
Okay, name them.
Trigeminal.
Yeah,
Abducens.
okay,
Facial. Vestibulocochlear.
okay. What does 5 do?
Sensory in the face.
Okay, what else?
Motor to mastication.
Okay, 6,
Lateral rectus.
name it.
Abducen.
Okay, you're too smart, you stop talking. Who else? What does 6 control? Abduction of the eyes, okay. What about 7? What is it? Okay, what does it do? Okay, what else? What on the tongue? Motor, sensory, or what? Salty, sweet, and sour in the anterior 2/3 of the tongue. Okay, what about 8? What does 8 do? Okay, vestibular hearing. Medulla. What comes out of here? I really need something from this side of the room, please. Anybody? Name them. Attaboy. Okay. What try are you in? 5. Okay. So you're in neuro now, correct? Name them. Okay. 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 There we go. What does 9 do?
Tongue.
Okay. What sensation? Bitter. Bitter back 9. What do 9 and 10 do together? You. Okay.
What's up?
Pittsburgh. What's that?
The gag.
Perfect. What else? What other reflex? The carotid reflex. Very good. And it'll also pull off palatal elevation. What is 11 in charge of?
Motor to traps.
Okay. 12? Hypoglossal.
Hypoglossal.
You got it. And this is not the sexy part of learning neurology, but it helps you localize lesions as far as function of different parts of the brain and brainstem. Okay, so you guys have learned some tests, correct, for each of these?
Yeah.
Okay, so if you see a deficiency in either one of these, it helps you localize to a specific region. So then you know at least what you're trying to shoot for. Does that make sense? What are good cerebellar tests?
Tandem gate.
Say it again.
Tandem gate.
Okay. What else? You. DDK?
What were you asking?
It's okay.
It's the activation.
There you go. What else?
Cerebellar. Oh, okay. This is activation.
Okay, that's DDK. What else?
That was hard.
Very good. Finger to nose. Feel the shin. Are eye movements important for cerebellar function?
Yes.
What specifically?
Diagonal.
Including retinal slip.
You're too smart, dude.
They know that too. We talked about that last time.
Okay. I need a volunteer. Need another one. Patient or examiner. Okay. So, she already called patient.
Okay.
So you get to do a cerebellar exam on her.
I don't know how to do
I thought she was
that.
leaving.
Honestly, I don't
Okay.
know.
Who's going to do a cerebellar exam?
Yeah, not me. I can do it.
Let's do it.
You can do it.
What's up, Tracy? While Tracy's coming, guys, this is grad school, right? This is once you get past undergrad. Undergrad school is where you get information. Grad school is where you start to give off information. You can use that in this class too, right? Like guess, provide something. Say if you don't know that, you get it wrong, right? But somebody else was thinking it too. So nobody in here is perfect. This is why we're wasting our lunch hour. Not wasting, but we're using our
That
time.
hurts, bro.
Sorry,
You
dude.
don't understand the drive that we had to get here.
Okay, but
Yeah, that's true.
get the peanut gallery out of the way. This is why we're here to get better, right? If you just lay back and sit quiet, you're like, oh, I think I know that, and somebody says the right answer, you're like, yeah, I knew that. No, you didn't, right? So take a step out, be brave, and try it. Let's do it, Tracy.
Okay, Layla, will you please stand facing me? And first thing I want to see you do is finger touch. I want you to do as wide and as good as you can, as fast as you can. Control yourself.
Okay, let me ask this. Is this more cerebellar or frontal lobe?
That is 50-50. Cerebellar?
Frontal lobe.
Yeah,
Frontal
it's
lobe.
more
Sorry.
frontal.
So I'm
Okay.
trying to, guys. I'm trying.
Okay, no, that's good.
All right, so let's do the DDK. So first I want you to bring all the way out. And as fast as you can.
What's this test called?
Just diagogokinesia.
Rapid alternating movements. If you have a positive finding with a breakdown, then it's called dysdiadochokinesia.
Now I want you to bring it in.
Wait, what'd you see?
She had a lot of breakdown on the right side. I mean on the left side.
Okay.
Just block your left
Okay.
wall.
Go ahead.
Right, now bring it in closer. And same thing. Touch it.
Better, worse, or the same?
He's waving.
Wait. I heard better, I heard worse. Which is the case? So it was worse with the elbows flexed. Okay. Now I'm going to ask everybody else, because you're already under the gun. What's the difference between this position and this position?
No, that's
Okay.
not one.
Midline or interposed?
It's interposed.
Okay, so now again, just as a preface, this is going to be a big lumping together. It's not necessarily the most accurate, but as far as beginning to understand what you want to do with your physical exam, this is going to be a good basic guide of lumping things together for treatment as far as holding it all together or whatever the title of this is. So, cerebellum, 3 zones. Midline, intermediate, lateral. What do you got here?
Vestigial.
Right. What else?
Inner.
Okay, fat guys eat donuts. Perfect. Works every time. So, more midline and axial, proximal joints, distal extremities. Everybody's comfortable with that? Okay. Proximal joints, because all the movements come from the shoulders. You go more distal, it becomes more lateral. Out on the fingers, that's dentate. That's as far as you go. Is everybody comfortable with that? Cool, please go on.
Oh.
Stressor, put it out here.
That left pinky.
All right. Hang on. So turn the face this way. You stand off in front of her so that they can share. And you're fine. Okay, keep going.
Okay, so stretch out and as fast as you can. Yeah.
Okay, what do you see? What does everybody see? You stop talking. What was the finding? Okay. So what are we thinking at this point? Okay.
Lateral.
Which part? Okay. How was rapid alternating movements out here? Still not that great. Is that correct? Agreed. Okay. So the more lateral you go, the more challenge it gets. Everybody agree?
Yes.
But still, the intermediate has its own issues. Okay. Keep going.
So now we're going to do track your eyes. So,
Do it.
Problem. So once you, I do this right. No, correct me if I did wrong.
Take a deep breath.
I want you to follow the thing. And then we'll follow. Right.
Okay, what do you see? Okay. Can any of you guys see that from there? Cool. Everybody come on up. I know it's lunch and we're tired. All right, so everybody get awkwardly close. Come on.
Awkward because I feel so loved.
Let's
so
do
loved
it.
right now. Okay,
You got
ready?
support now.
Okay, ready? Keep your head still.
What did everybody see? Okay, which direction?
Left.
Okay, what else?
Going down into the left, she kind of jerked.
How many people saw her stop breathing? Anybody?
I didn't do that one.
Okay,
Can I ask another question, Dr. Schultz?
lay it on me.
Anybody else, other than the breathing in the eyes, did you see anything else from the neck up that changed?
Just saw her move her head.
So what was that?
I saw her move her head.
So movement of her head, right?
Mhm.
So you got three positions, right? Roll, tilt, roll, yaw, pitch. Okay. What else did you see? There was more than just the head, but
Yeah.
we're just going to stick with the head because she had about 8 things that happened. But from the
We're
neck,
going to leave it there for simplicity's
yeah,
sake,
for
though.
simplicity's sake, from the neck up, did anybody else see anything not related to the eyes? Not related to him? Okay, facial contraction, which side?
Not right.
More, you did it when you said it, so you showed it, but right side. Yeah, her right eye closed, and the corner of her mouth on the right elevated. So she changed the tone in her face with the eye movements too.
Okay, this one.
So what Dr. Schwartz is saying and what I'm saying is, you're looking at the eye movements, but are you looking at just the eye movements?
All right, go for it.
Getting that kind of feedback.
Huh.
So get her to do this.
Okay, so here's what we're going to do. Finger to nose.
I couldn't remember that.
First, arms out.
Okay.
Close your eyes. Touch the tip of this finger to the tip of your nose. Bring it back out.
That's right. And then that
Okay. And then that one. That one. I'm just going to assume everybody saw that. That one? Okay. Okay. Now, what did everybody see?
She
Write that down.
And then also, her right hand dropped from her left hand. Sorry, that.
Okay. And then everybody caught this?
Yeah.
Okay.
Mm-hmm.
Yeah, dysmetria on the left. We'll just keep it real simple for right now.
Who?
Dysmetria. On the left.
Well, spell it.
This, DYS.
Is that this one?
Next you're going to do
Metric without C.
Okay, I can't
To
hear
mine.
it. So I'm
Yeah,
sorry.
that's what I was thinking. Okay. Okay, so just put just one hand to mine. Right. Okay, so Layla. So I want you to touch your finger to my finger and back to your nose as fast as you can.
So you want to hit every quadrant.
Okay.
You're good. Good.
Perfect. There you go. Switch sides.
Okay. Other hand. Ready? Okay. Sorry, that was my bad.
There you go. Make a reach. Perfect. Okay, good.
Okay.
Nice. All right, perfect. What did everybody see?
Hesitation. Is it really when her elbow is out this way instead of out here?
Say that again?
Her elbow is out here.
Okay.
A lot of them.
That's good. That's good.
Stick with the basics on this one, though.
Okay.
First, you're absolutely correct.
Accuracy is
And that
awesome.
is significant.
Okay.
But did she hit her nose? Okay.
just missed it.
On either side?
Lightly on this side.
Better on the right than the left? Okay. Was there a tremor?
Oh, didn't know that.
Oh, shame on all of you. What have you been teaching, Jason?
Do what?
Okay, do it again.
Okay, I'll try to do better. Ready? Okay, start.
Make a reach.
I'm sorry. I'm not gonna pass it.
So, yeah.
Somebody else might want to do that one.
Tremor or no tremor?
Tremor.
Okay. That's good.
Okay.
Good. Where'd she go?
I'm right here.
Okay.
What am
All
I
right.
hurting? Trimmer?
Tremor. Both sides. Terminal tremor.
Walking?
Yeah, bilateral. BL.
Walking and turning?
Okay. So, next we're going to do tandem gait.
No, I'm walking.
Yep.
Okay. Walking.
Gait. No? Okay. So that would be just gait. Tandem gait is you're going to everybody's seen Cops, right?
Sobriety time.
Yeah.
Okay, so walking straight.
Heel to toe, touch them. Okay, all right, good. What did everybody see?
Picture, Jason.
Relax, just walk back normally. What did everybody see?
She had to look down.
Yeah, exactly. There you go. Big findings. What were they? Come on.
Off balance.
Okay.
She had to look down.
Okay. Did she fall?
Yeah.
Which side?
The right.
Every time. Okay. Did she have tremors in her trunk? Okay. Did she have a vestibular compensation to put her arms out to try and balance herself? Okay. If you're falling, is that a normal response? Yes or no?
You try to catch yourself.
Yes, it is. Yeah, they're trying to protect herself. Absolutely. So you know that system's at least intact to some degree. Did everybody agree on that?
Yes.
Okay.
That's a big point.
Okay.
Lie down.
All right. Tremors of her trunk. Where in her cerebellum are we looking?
Midline.
Midline. Perfect. If we were looking to address that immediately, what's the best way to stimulate midline cerebellum?
Adjustment.
That everybody's going through chiropractic school learn how to do.
Rib adjustment.
Light it up.
Take a test.
Yes.
Passport.
Yes. Interferential. Okay.
Interferential.
Passport.
So, now, DDK in both positions. What part of the cerebellum?
Lateral.
Not everybody once. Okay.
Stay quiet.
Arms straight out. We're here. Elbows flexed. We're more here. Already got this with the truncal tremors. Okay. Dysmetric. Finger to nose. Where are we looking there? Okay. Inhibition. Okay. Tremors on both sides with finger to nose. Is everybody comfortable with that? Okay. She always falls to the right. Why is that? Okay, what are the three systems we use for balance?
Visual, cerebellar, or proprioception, and vestibular.
Okay. All right. Which of those have we tested? Okay. How was their visual system as far as extraocular movements? Okay. Challenged, yes? Okay. What about our vestibular system? Why? Okay. How could we better test that?
Eyes closed.
Okay. So, balance testing. How would we do that? To most heavily influence the vestibular system.
Change the direction of the head.
Okay, so remove the other two systems. Closed eyes on a dense foam pad. Okay, that will favor your vestibular system. Is everybody with me? Okay, so if you have them turn their head, what does that do?
It's going to activate and dampen different semicircular canals.
Okay, so if she's standing here like this, which canal is she stimulating?
The left anterior.
None of them. Because there's no motion. So at that point, the vestibular stim is gone. Does that make sense?
Mm-hmm.
How else could we test? How would you test cranial nerve 8, the vestibular portion of it? VOR, Helmighi's, stuff like that. Okay? So if we were going to go down this pathway, that's what we would do next. Proprioception. What's the best way to do it? Okay. We have Romberg's, and then some dorsal column stuff. Okay, so we have vibration sense, joint position sense, light touch. Okay? Anybody uncomfortable with that? Does anybody have any diagnostic tools with them? Okay. Okay, so we already know left cerebellum has some challenges, right? What about 5, 6, 7, and 8?
You can see some 7 issues on Rhythm 7.
Yeah, okay.
Upper or lower.
Fastest way to test 5.
Facial sensation.
Sharp and dull.
Okay, sharp versus dull to the face. 3 distributions. Go for it.
Just your finger.
Try your fingernails.
I got it.
Fingernails
Um,
versus-
Use your eyes open or closed?
Close.
And then that's same.
That same-
Okay, so
about
what are the
same
3
thing?
distributions of the trigeminal
Well,
nerve?
here.
Yeah.
Okay,
Okay, so each
Did
one.
you get all 3?
Oh, I don't remember how I do it. I just remember the area.
That's fine.
Okay.
Same.
Can you go up and down from there? Really lightly.
Same. Same.
Okay, so you're comfortable there. You're comfortable the sensory component is pretty good.
Yeah, it looks pretty good.
What about motor?
Okay, so motor on that. Oh, your tongue and uvula? No, not that one.
Clench your teeth.
Clench your teeth, okay.
So you're going to palpate masseter and temporalis. See for a difference in tone.
Oh, just palpate it?
Yeah.
Oh, okay.
You see a difference?
Yep,
Which side?
this side.
Has more or less?
Left.
Okay.
Okay. Temporalis. Again. Still less.
On the right side. Okay. So the motor of 5 isn't quite there. Okay. Swing your jaw to the side.
Never done this.
So, okay. Don't let me push. Good. Switch sides. Don't let me push. Good. That one I'm comfortable with.
Okay.
Okay. So 6 we've already tested, correct?
Yes. Abductions.
There you go. Abduction. So now 7. How are you going to test 7?
Facial, motor,
Okay.
tongue. Is that the pharyngeal? The uvula test? The cough, and all that.
That's
big
not
one?
good.
Okay.
Facial expression.
Oh, smile. I'll smile. And raise your eyebrows and all that. Okay. So smile. All right. So we're checking to see. Which
Anybody
one's
see any
higher or-
differences?
Yes.
What?
eyebrows raised.
Mhm.
Okay.
And the
Smile,
lips lower.
frown.
Frown.
That one.
Okay.
This is actually
What you do?
This is
Angry?
actually really good when you're establishing a relationship with a patient. A good thing I do is I do it with them.
Yeah.
So that we both like,
Okay.
I mean, really, like, if you can laugh with each other, it makes your job way easier.
Okay, so
Keep going.
smile, and then frown with your eyebrows. Okay. Now
That's
raise.
usually the one that gets the laugh.
Okay. Okay, then raise.
How about your cheeks?
Okay. And
That one too.
Ooh. Wow. Okay.
You saw the difference.
I did.
Got more on our left.
Ooh.
Okay.
Fire.
Do it again. Yeah.
Mhm. Okay.
One more.
Come on.
Yeah. All right. All right. So we got 5 on the right. 6. What'd you find on 6? It was intact, correct?
Yes.
Okay. We'll just leave that there for right now. 7. What did we find?
Right. And left side.
Oh. Well, the left was more diminished, right?
Where?
The right eyebrow raised more and the left.
Okay.
And
So.
Looks like there's a lot going on with 7.
Okay. So on our super accurate drawing. Right? Okay. Give me. Where was their less tone?
The right.
Left on here on the cheek.
Okay.
Well, I mean, that was smaller, that means less.
Okay.
And then what did I say about the eyebrows?
No, she had a bigger puff on the left.
What about the smile?
I don't know about the smile. Just good
The
angle.
smile was diminished.
The right eyebrow.
Yeah,
right
it's
side.
not- it's
The
higher.
right eyebrow went up too.
Okay. So she's got better tone up here. Not so much over here.
And the smile was higher on this side than this side.
Okay. So decreased over here.
Okay.
Okay.
Yeah, I don't know. What else? The label fold, the intranasal label fold.
Give me a consensus. I didn't have a good view of it. What happened?
More tone on the right.
Right forehead or right face entirely?
Right face and
Okay.
is higher. It's higher.
All right. All right. 9, 10, 11, 12.
That one.
Okay.
So, okay.
Open wide, say oh.
Open wide, say ah. Okay, and we're gonna watch for the uvula to the membrane on each side to go up and down it. So I want you to say ah with your mouth wide open where you can see it. Oh, I'm sorry.
That's weird. Don't stick a camera in her face.
Yeah.
That's just awkward for everybody involved. This is going to have a life of its own at some point. But when you do it, you're not looking for a tonsil to deviate. Because anatomically, they're not that symmetrical that often. So you're looking for the big canopy on either side. That's where you're looking for the big difference in tone. Okay? Say she has decreased on the left. What does that mean?
Stay outside.
What does that tell you about 9 and 10 on that side? Okay? Can you expand that to medullary function on that side? Pretty reasonably? Okay, so we're just going to say that she had decreased palate on the left. All right, 11. What do you got for 11?
Sharpness.
Perhaps not that.
Correct?
I don't know what to do with that one.
Okay.
What do you do?
Who does?
You do that one.
Who was here last
Oh,
week?
it says here,
Not Bryce.
I mean, that's your traps, that's your SEM, and turn
Correct.
your neck.
How would you test it?
Maybe turn your neck and see your SEM.
Okay,
See.
so first thing you're going to do, there you go, check for
Here.
tone. Check
Oh,
for
okay,
tone.
okay. All right, so that's what we're using. Shrug your shoulders.
Just check for tone first.
Oh, okay.
Like literally palpate the
Oh,
muscle.
okay, okay.
Because if there's atrophy, you want to know that before you go and test it.
The
Breathe.
biggest thing you see is people forget this, they skip tone. They don't palpate.
Okay, so she's got
Say that again, Nick.
hypertonicity here, less
The
on
biggest
that
thing
side.
people miss is they don't palpate tone.
Okay, so she's got hypertonicity on this side, less
Okay.
on the traps.
Okay, let's see him.
Okay, SEM, can you turn?
No,
that?
hang on.
No.
So-
You just, and then opens here and here.
So take it and actually roll it in your fingers.
Oh, okay. Getting up to y'all's
Yeah. I mean, you're in chiropractic school.
Yeah, that's right.
Fair?
That's right, fair.
Okay. What do you
I'm
got?
up here.
I'll be back.
Actually, feels like there's less on the left.
I agree. Okay, now you test the motor strength.
So,
Shrug your shoulders. Don't only push down. So you
Okay,
don't want to be on a
less on this
clavicle.
side.
Yeah, out here. Push. Good. Relax. Okay. What about SCM?
can we do the same thing?
Okay. So what it would be to facilitate that? Bring it in here. Don't
On
let
that
me
little
push.
push, okay.
Oh, you're using your scalenes.
Yeah.
See your cheat?
Yeah.
Who caught that? Everybody get in on
Hair
this
is kinda
one.
in the way. Yeah.
Have a hair tie?
Yes, I do. In my purse.
Oh, okay. Never mind.
Okay, so turn your head. And
Okay,
push
hang on.
against-
So, if you're going to do this, don't knock her over. Put your hand on her back.
Okay. This way. Okay. All right, now push against me.
Does everybody see her cheating and using her scalenes to try and support? Relax.
Okay.
Instead of her SCM? Okay. Okay, hang on.
Is this no, too far?
Give her a chance first. Let her dip her head.
Sorry. No question.
Okay, better but still not. She's recruiting. Okay, did everybody catch that? This is one everybody test somebody else right now. This is one that's important that it's done right.
And then first, and then turn on it, and then college top, and you support my back, so it'll push me backwards. I'll get to the side of me, and now put your hand on my back.
Would you break it?
And now have me push against your You're going to feel it was running from there. Push your hand.
So let him.
It'll be easier if you put your hand on this side of her head and hold the other shoulder to support, so come in front of her.
Okay. Oh, I'm sorry, my bad.
Put this hand on that shoulder.
Learning as I go today.
Yeah. And then now get her to turn her head.
Turn your head.
That way, yeah. And then put your hand on the side of the head. Slightly more anterior. That way she's turning her head.
The opposite side?
Yep.
I'm sorry.
It's checking that reflection
And then do like one side weaker or stronger than the other. And this time you can do it annually. Okay, it's good line up.
I'm not understanding because when we do the it's hard to do. Get it?
Right side, okay.
Like, let you lead the dance. Like you did like this, hold, that's why.
So yeah, fairly lateral. That way she's trying to shrug her shoulders.
Okay, bring it back in.
Weaker.
Okay, so next we have 12.
Oh, 12 is top awesome.
Correct.
Yeah, I gotta go through that.
Yeah, no, I get it.
Wait, top muscle is everything down here.
We're going to focus on the tongue.
The tongue, okay.
Okay? So,
Rolling? No, that's just okay.
stick your tongue straight out.
Stick your tongue straight out.
Okay. Now, what people are going to try and do not film this. What people are going to try and do is like purse around their tongue. They're going to go and support it. Don't let them. Make them go straight out.
Straight out, okay.
Okay? Don't let them cheat. Do it again. Okay. Questions? Is it midline?
No,
Where did it deviate?
to the right.
Did everybody agree with that? Okay. Was it steady or was it shaky? You're mean. Okay.
that long.
Okay. So, right deviation, not steady. Okay. Which side are we thinking of the medulla has the issue? Why the right? Okay, so with the tongue, essentially you have two muscles joined into one, and it's basically a shoving match. So if it deviates to the right, the left is overpowering the right. So either that muscle is genuinely weak or it's not getting the activation that it needs to be able to push back. Is everybody comfortable with that? Okay. So the next step in this is you have her push her tongue against the inside of her cheek, and you push against it. Before you do, what would we expect to find on this if everything goes according to plan?
Right weak.
So what you would expect is that it will be stronger going to the right, because the left is going to push. It's not a pull, it's a push. Okay? See what you find.
It felt pretty balanced to me.
Okay?
It's pretty strong, actually, on the right side.
Push it against this one.
Okay.
This one. Okay. And over here. Oh, it's because she's cheating over here.
Oh.
She's tucking it up next to her teeth.
Ah.
Yeah. All right, let's break out and try that one.
This is right.
So when you make them push their tongue into their cheek, make them go right out sideways. Don't let them hit it up.
What are you doing? I totally was. I was pushing it up between my teeth. Oh, you're so
I have no idea. That's funny.
Left side. Yeah, pushing it right. The right side. Motion to the right side.
Correct.
So that means
Which one?
the right side's
Weaker or stronger?
That's what I would expect.
Same, like. I'm exhausted.
If you guys want to feel like, you know, what an actual week feels like, Nick's got one. Not like five.
Hold that for a second.
If you guys want to feel it, feel it.
It's the one in the red.
Oh, okay.
It's weaker on that side.
Great job.
Kill it. Hey, you get 10,000 points for having the right.
I don't even have the manual yet.
Hey, you're doing great. You know who's getting the most out of this today? You. So everybody else is in here, you're probably gonna forget this, so you're gonna have it because you're gonna do this for a long time. So you're doing awesome. And he's tough love, right? So he'll call you out, but that's perfect.
Because these people need to know.
Yeah, but nobody else is really
So you should see it sticking out one way and then we go.
Oh, you're fine. No, probably not. You were standing back here.
That's what was going to come in handy.
It's like,
All right, guys, let's bring it back in.
I would. I'm trying to like tell you to still third.
All right, so what were the big findings we had with Layla? Okay, does everybody agree? What else?
Right.
Oh yeah, so that's the right tongue.
What did we find in the ponds?
Right.
5, 6, 7, 8. What do we got?
Facial on
6 was good.
right side. Right facial.
Okay. Master tone was decreased which side?
On the
Decrease on that.
As the right.
It went right.
The masseter?
Oh, the
never mind.
masseter. I didn't hear exactly. It's a master tone or something. Masseter. Sorry.
Okay. 7, what did we find?
Do we say pawns on the left?
Decrease left.
We're coming to that conclusion.
Yeah, decrease left on that.
Okay.
7. 8.
One thing we didn't do is we didn't test the VOR. Let's do it.
Turn her head.
Is that the one where you
Okay.
shoot it right?
So,
Turn around.
3 semicircular canals.
Yeah, so it's
What are the
making her
3
dizzy.
planes of the vestibular system? You're dizzy.
Real dizzy. 3
McCloskey.
planes of the vestibular system.
Please test her vestibular
Yeah,
system.
right here. No, thanks.
I like my nose, okay?
Oh yeah.
Yaw.
Yeah. Down.
Roll.
Ooh, y'all come here.
Yep.
Ready? You still on my nose, yeah?
Yep.
What are her eyes doing right now?
Pulsating. Constricting.
Oh, there she
Does
is.
the light make a difference? Does
Yeah,
she have
Let's
light in
step
there?
over here. Just
Yeah.
Turn her.
Cool. So torsional roll, not so hot. Where do you go?
What do we find?
Both torsional bilaterally not good. Scotic intrusions is pretty clear. Horizontal is pretty clear in pitch too.
Okay, roll. It's going to be more associated with cerebellum. Is everybody cool with that? Okay. So, cerebellum on both sides, correct?
Yeah.
Okay. What part of the cerebellum?
Midline.
We'll keep it at midline for simplicity's sake. Okay. 9, 10, 11, and 12. What do we got on the middle?
Weakness of 9.
Okay. So 9 and 10. We just said left palate. Okay. One thing we didn't test was the carotid reflex. You want to do that? Okay.
Yeah, I don't know how to do that one. I don't remember what we did.
Doesn't matter.
No,
Okay.
I'll learn it.
So cool. So here's the fun thing: is all the cranial nerve stuff. You really don't need any fancy equipment in any way, shape, or form. It's literally right out of DeMeyer's. Okay. So you're gonna check her pulse. I'm gonna press it on your neck. Okay. What would we expect to see as I apply pressure to her carotid artery?
Drop.
Okay. What cranial nerves is that? Okay. Okay. Will you check that?
Sped up.
Will you check that?
Ready?
So you're pushing it on the muscle from the side.
Okay.
So you push it back.
Okay.
Yeah.
Ready?
So you're going to go in, you're going to find the pulse.
Got it.
And you're
Yeah.
going to apply right there.
Got it.
What do you got? That's
Spread up.
Okay. All right. This is one I definitely want you guys to try on each other. Obviously, be smart about this. No, yeah, exactly. Yeah, bilateral at the same time. Okay, so what you're going to do is you're going to take the radial pulse. You're going to lightly palpate for the carotid pulse. And then you're going to start to apply pressure. You're going to look for a change in heart rate as well as the amplitude of the pulse. Okay? Pair up, let's do it.
And just before you guys, just before you guys do this, can anybody tell me why you don't want to do it on the left? Because Dr. Schwartz is saying do it on the right. Why can you not do the same thing on the left?
Because right controls rate,
And what does the left control?
rhythm.
Okay, so if you change somebody's rate, not a big deal. You give somebody an arrhythmia,
Yeah. Not be a big
do a
deal.
big deal. Okay? So say the bet, unless
So
you're
don't
in a
be dyslexic
situation
right
that
now.
absolutely
Do
demands
not.
it, stay away from the left. Okay.
Yeah, so you push from here, like up against the bone. Yeah. Do you feel it?
Oh, yeah.
Yeah, perfect. So then get your feet. Sit around there.
Good.
Be sure to warn them before you just start pushing on their neck.
Yeah. That's cool.
He doesn't have one? He doesn't, his didn't change?
Supposed to do that.
That's right. Question.
Here.
See somebody turning white, let go.
And so yours did more. That's normal. Yeah. So why did yours feel
And also,
It's just
sway away from the light. Turn all the way.
Be able to see. That's because I didn't.
Or have light flashing.
All those are flashes. And I bet yours is faster. After all
me.
those injuries.
Yeah.
Okay.
Here, come check me.
He's
It's a lot
You're
better.
probably like. Okay, ready?
It doesn't change.
Anybody find anything cool? Anybody find anything other than normal? You guys? Normal? Perfect. That's what it's supposed to be, right? Would you have?
Slow down.
It
Yep.
slows down. It slows
How
down.
long
It
did
slows
that
down.
work? Where does that go once you feel the slow down? Okay.
Can I feel you?
Sure.
Wait, so now I put it in?
Yeah, of course.
Yeah, set up.
I mean, I felt my own spit.
Yeah, real good.
I was like, I feel that
All right.
myself.
Still can't really feel a difference.
Yeah. Did you try it out?
Yeah.
Okay. I think that you actually don't have as good visuals in here. So like, did you have really steady, like solid, where you couldn't really tell? So like, I'll usually trap it up against this bone. And you got the much better, and you find it stronger. So now once you really feel it, now I'll apply it, and you just focus on that, and don't close it off like too much. But just close it there. Yeah. So you've got it. Hold it.
Did you really just show me a race to the board?
Yeah, pretty much.
Give the people what they want.
That's cruel.
All right, guys. Did anybody find anything interesting, period?
Yes.
What?
Slow down for about 2 beats and then sped up.
Okay. What's a normal response on this one, guys?
To slow down. Just
Anybody?
normal response.
Yes.
It's going to be to slow down.
Rate
Decrease.
decrease amplitude.
Okay.
For about 10 seconds.
Okay.
Returns to normal.
Right. So this is one of those that once you feel it drop, don't let go right away. See how long it takes to return back to what it was before you applied pressure. Okay? Anywhere from 6 to 10 seconds is really the window we're looking for. Okay? So, we have a bunch of findings. Everybody agrees?
Yes.
It's going to be real boring if you don't respond. Okay. So, everything in our midbrain was pretty good. Yes? Okay. Pons, challenges?
Yes.
For sure. Medulla?
Yes.
Yes.
Okay. Also, cerebellum? Okay. So, not really worried about that one. What are we going to do to work on these? To stimulate function? At least try it and see if we get a change. What are good options for the pons? What cranial nerves come out of the pons?
Five, six.
Okay. Did we have a trigeminal finding?
Yes.
What was it? You.
Try one.
Good. Well, I'm glad you came out. Who's got an answer? Other than Nick and Tyler and McCloskey and Larry.
Yeah.
Master. Okay. Which side?
Right.
Okay. What side of the pons is that coming out of?
Right.
Okay. So, what would be a good way to light up a part of the pons?
Cervical adjustment. And kind of cervical adjustment.
Okay. Let's get a little more specific and leave the cerebellum out of it. In that regard.
Vestibular maybe?
Okay. Could try vestibular. What could you do to more focus it on the trigeminal system?
Stimulate sensation.
Vibration of the face. Very good.
Yeah.
Cool.
Yeah.
It was coming on.
Sensation.
I was thinking vestibular.
Sensation.
Knee vibration.
Okay. Which side would you want to go on?
Right.
On the right.
Ipsilateral. You got it. What else?
For pons, facial left sensation or left.
So if you do
lower-
a stretch on any of those muscles in the face, is that going to go into the trigeminal system? You got it. Okay. 6 we were okay with for today's conversation. 7, what would be good?
Facial lobe. Which one? That was all this.
East down.
Got it.
I don't know what the problem is. but
You got it.
that's
Okay, so 4, 7. You could do to the face. Okay? And you'd want to go specifically to the parts that were deficient. Okay? Again, you're going to use real low-level currents and pay real close attention to fatigue on this one. Everybody understands why, yeah?
Mhm, yes.
Because when the
Yeah.
pons and medulla fail, the midbrain takes over and things go bad. All right? Vestibular system, what would you do?
Balance techniques.
Okay? She specifically had challenges in roll. What would you do?
Rolls front to back. That one? No, hers
Rolls,
is lateral.
yep.
So like a
Rolls the airplane
like a
one.
the balance board exercises or
Okay.
something. I don't know.
Anybody else?
Somebody advertise.
Not really.
Help.
Okay, so good suggestion.
Good.
She had problems going large amplitude, correct?
Mhm.
But for the first few degrees, she was pretty good. Does everybody agree? Is that what you saw?
Yeah.
Okay, so what you would do is you would make that plastic and go those first few degrees on either side, and then slowly push her to get better and better and better.
Okay.
Is everybody comfortable with that?
Just more stress.
Okay,
Using the test therapy.
correct. You got it.
Okay.
And then the best thing about that is as you're doing it, you literally are testing to see if you're making progress or if it's not. And if it's not, you need to try another approach. Okay? 9 and 10.
Gargle.
Perfect. What else?
Yeah.
What about humming? There you go. What about using the carotid reflex therapeutically?
Absolutely. Well, no, not
It's energetic about it, though, folks. You gotta
Yeah. He believed it. It was
I
good.
didn't for half a second.
Okay. Will it light up that part of the medulla? Yes. Why would it not be the best idea to repeatedly
Just because that's
stimulate
not
that?
something you want to use on.
Because eventually you will attenuate that reflex, which is really important. So I love your passion. Just misguided. Okay. All right. 12. We had deviation at 12. What would you do for the hypoglossal nerve? Exercises in your mouth with your tongue. Perfect. Way to go,
Okay.
Tyler. Total redemption. Okay.
I mean, if you want to eat them too, that's a good one.
Okay, so if you have the ability to pull off E-stim, perfect. The waveform's real important on that one. What about taking a vibrating toothbrush and taking the handle end and applying it to your tongue?
I would think it would work.
Large diameter afferentation.
I didn't want to volunteer that particular.
Showing your hand here, Tyler. Right. Okay. After you apply any therapy, what's the next thing you do?
Test.
Retest it. See if you're actually doing what you think you're doing or not. If you're not, what do you do at that point?
More
You
therapy.
change your approach.
I have
Okay.
a question.
Yes.
So coming from out of every doc that's at the CBC, this guy probably adjusts the most people. Probably more than, well, I'll leave it at that. Adjust a lot of people, right? So teaching at Parker, all these modalities, is this instead of a chiropractic adjustment? Why are these better than a chiropractic adjustment? Would you still do a chiropractic adjustment on top of these modalities?
That's a really
Or-
good question.
Thanks, Dr. Schwartz.
So good.
Thanks, man.
And the answer is, if metabolically they can tolerate it and you can target the specific system that you're looking to activate, a chiropractic adjustment is a fantastic tool to change the function of somebody's brain.
Okay.
This can be, all of these modalities can be instead of, as well as in addition to.
Okay.
So that's a fantastic question, and I hate to use the cop-out answer, but it's so case-specific. But that's my answer.
Cool.
So case specific.
Can I add something to that?
Fragility.
Do it.
Okay. So using the carotid reflex, for example, okay, the reason that we don't do that is because it's hyperactive. So if we activate it, we're gassing it. Okay, it's a good rule of thumb, and almost everything, and Dr. Schwartz can give a caveat to this if I say anything that he doesn't agree with. But if you have a tendency of anything in the body that it's already overactive, and you do something to stimulate it, you run the chance of gassing it even more. It's a safe bet unless you know exactly what you're doing with the specificity of your adjustment, and until you learn that, to take the rule of thumb that you're probably going to gas the patient. With an adjustment, you're probably going to afferentate or give them enough stimulus that you're going to hit the gas pedal. So unless you're sure that hitting the gas pedal on that patient is something that you want to do because you need to speed them up, make sure that you take that in consideration, because just like the carotid reflex, if somebody's already going fast, adding more speed is not going to necessarily do them any favors. Some situations it might, but safe bet until you know enough to specify it, probably not generally going to be the case.
What's the best way to learn that lesson?
Mess up.
To light somebody up when you shouldn't have.
Yeah.
Done it. more than I care to admit. But it's one of those, you never know where the limits are until you cross them. So that's why doing testing, applying a treatment, and then retesting is so important. You're going to learn from it just as much as hopefully they get a therapeutic benefit out of it. So that the next person you see, you can respond even more appropriately and give them a more accurate therapy.
You only get pretty good at tuning a guitar when you've broken a couple strings.
Sure. We have to get back to the clinic for patients. Thank you guys so much.